Hello, I'm Dr. Jason Ballenbeck, Towne Animal Clinic, and I'm here to talk to you about internal parasites in cats. It's spring. This is the time of year we start thinking about GI parasites and heartworm disease, especially in dogs, but cats as well. Cats get heartworm disease too. The big problem that we're now dealing with cats is we're realizing that the tests we have available are not very reliable, and that there are actually more cats out there that have heartworm disease than we first thought. The other problem is actually treating for heartworm disease. There is not a treatment that is safe for cats and that's effective on the market. So if a cat gets heartworm disease, you're stuck between hoping that the worms die before the cat does and dealing with the clinical signs. So our best thing is prevention. And there are some really good heartworm preventions for cats in the market. There's Revolution and HeartGuard. I personally like Revolution because it protects against fleas as well as some of the GI parasites and heartworms and ear mites. And that's what I use on all my cats that go outside. So that's probably the first side of this. The second side is dealing with GI parasites. GI parasites in cats are roundworms, hookworms, whipworms, tapeworms, giardia, and coccidia. We see all these parasites. We generally recommend testing for them through fecal analysis and things like that. Fecal analysis are somewhat reliable, but at the same time, we're limited to when those parasites are being shed and if the eggs are being shed in that specific stool sample that's being analyzed. So really, fecal analysis shouldn't be used alone. We should also be using routine deworming. Now, for indoor cats, deworming once a year is enough. For cats that go outside, and that being outside can be really just going out once a week, they really should be dewormed 4 times a year. And mainly cats that go outside do hunt, and if they're hunting for mice, they're going to pick up tapeworms that way. And tapeworms are extremely hard to find in stool samples, so really your best thing is to deworm. The other side of this is that roundworms and hookworms are also contagious to people, and especially in children. And there's the CDC has seen a 45% increase in roundworms, hookworms in children, and those infestations blindness in those children. So it's important to deworm especially your outdoor cat on a quarterly basis, and you're to keep all your bases covered. They did a study that 14% of indoor cats actually have GI parasites, which I thought was pretty staggering for indoor cats. And outdoor cats, it's very high. It's as high as 80% of outdoor cats just because of hunting and things like that. So if you have any questions about any of this, please give me a call. It's 703-777-6350. Thank you.